Now, we have a lot of exciting conversation today, but specifically we love to talk about health here on Mountain Connections, and November is actually Diabetic Awareness Month. We actually have a doctor that specializes in neuropathy and also a guest that is suffering and recovering from it, a patient from this. So let's have a conversation with Dr. Silky Patel and patient Farrah. Thank you so much for joining us.
Thank you. Good morning.
Good morning.
So, Dr. Patel, tell us, how prevalent is DPN among diabetic patients?
So interestingly, 3 in 10 patients who have diabetes will develop diabetic peripheral neuropathy. It feels like a numbness or tingling that can start in your toes and go progressively up your legs. And what happens in diabetes is that you have high blood sugar levels, so it affects the nerves. What kind of patients get this most often are the ones that have had diabetes for a prolonged period of time.
Thank you so much for sharing that information. Now, Farrah, when were you diagnosed with diabetic peripheral neuropathy, and what has it been like for you?
I was diagnosed in 2018 with diabetes, and I started having symptoms of diabetic peripheral neuropathy around the same time. I was having numbness and tingling in my toes that would move up my legs, pain. It got to the point where I was unable to do normal everyday things, and I couldn't even work anymore.
Wow, that's pretty incredible to have those symptoms affect you on a daily basis. Now, Dr. Patel, how is DPN treated?
So, unfortunately, there's no cure for DPN. However, when a patient's referred to me, I like to start with conservative care like stockings and physical therapy, medications, but sometimes that doesn't work, as in Farrah's case. So what I like to do is introduce spinal cord stimulation, or SCS. It is a small battery-powered device that lives underneath your skin in your back, and it blocks pain signals from going from your spinal cord to your brain. The best thing about it is you can try it before you get it. It's kind of like test driving a car. And studies show that when you get SCS, you're 17 times more likely to get significant pain relief. We are here today on behalf of Medtronic, who worked hard to get FDA approval for SCS to treat DPN.
And Farrah, how has the spinal cord stimulation helped you in your treatment for DPN?
As Dr. Patel stated, I tried the more conservative measures initially, medications, physical therapy, compression stockings. I kind of knew what was going on because I'm a registered nurse and my mother is a diabetic, and she had diabetic peripheral neuropathy symptoms herself. So when it was time for me to go and see a doctor and explain my symptoms, I knew what to explain to them. And Dr. Patel kindly enough suggested that I try out the Medtronic spinal cord stimulator. We did a trial initially for 5 days, and that works so well. During the trial, it's worn externally. It's not implanted like the permanent one is, and you can see how much pain relief you get. And it works so well that we finally decided to have the Medtronic Intellis device implanted, and it has been life-changing. I've been able to do things that I wasn't able to do before. I'm back to teaching classes and attending events with my family, traveling, and it's just been a tremendous change in my pain levels and in my life, the way I'm living my life.
It's just incredible to have a device that really just helps you get back to normal functionality. Now, Dr. Patel, what advice would you give to people suffering from DPN?
Well, first of all, I would say don't give up hope. Go ahead and find a trusted healthcare provider or interventional pain physician who can take you through the journey of conservative measures all the way to potentially spinal cord stimulation. And to definitely visit the website dpnrelief.com, where you can find lots of great information.
Wonderful. Well, thank you so much, Dr. Patel, for sharing that information. And Farrah, I'm thrilled for you that you're having an improvement in your medical and health journey. And we appreciate you ladies coming on to create awareness for diabetes this month. Now, stay tuned. We have a lot more here on the show. We are just getting started. We'll be right back after this.